Hello, my name is Sumio. I am a teacher of the deaf at Sense Success, and I'd like to welcome you to part one of our deaf awareness training on supporting the hearing impaired student in the mainstream classroom. There are 4 20-minute parts to this training, and we recommend completing all 4 of them. In part one, we will look to understand the nature of a hearing loss, to understand the types and levels of hearing loss, and have a short introduction to audiograms. A brief introduction: around 80% of hearing impaired children attend their local mainstream schools. For the 20% of those students that don't, it may mean that they have a profound hearing loss and have chosen BSL as their mode of communication, or it may be that they have more complex needs. 1 in 5 children under the age of 5 will suffer from a conductive hearing loss, commonly known as glue ear. It is very important for those teachers working in the early years in particular to look out for this. If you notice that a student is not responding to you in the way that they would have done usually, it's really important to speak to parents and find out when they last had a hearing test. A simple hearing test may be able to pick up a conductive loss, and interventions can happen. The impact of a hearing impairment will vary from child to child. Some of our students with very profound losses cope better than some of our students with milder losses, and it really will depend on the child's personality, how well they've engaged with equipment, how well they're supported. So no 2 students will be the same. Many of our children with hearing losses will develop coping strategies to mask their difficulties. These include following cues from other people, learning routines very quickly. This we will talk about in part 2. Hearing impairment often has the greatest impact on language development, and again we will talk about this further. So if we're looking at the types of hearing loss, you may have seen an audiology report for your student, and it may state what type of hearing loss they have. If we can look at the diagram of the ear, you can see that that comes in 3 parts: your outer ear, your middle ear, and your inner ear. So as we know, sound will come through your ear canal as a sound wave. It will move your eardrum. Your eardrum will tap gently against the 3 little bones that sit in your middle ear. They sit so that they're not quite touching, so there's a slight distance between them. So as the eardrum taps the first bone, they will all tap together, sending the sound through to your inner eardrum. And then this snail-like organ that sits in your inner ear is called your cochlea. It's about the size of your thumbnail, and if you imagine taking a piece of garden hose and rolling it up, that is similar to your cochlea. So there is a space inside that all your tiny hair cells sit, along with liquid. Then the 4 black lines that you can see disappearing off to the right are your auditory nerve. So sound will come in as a wave, it will tap your eardrum, tap your bones, tap your inner eardrum. That will stimulate the liquid inside your cochlea, which in turn will stimulate your hair cells, sending a signal up to your brain. Actually, it's your brain that tells you what you're listening to, and your ear is just merely an instrument to get that sound there. So as you can see, there are lots of things that can potentially go wrong. So with a sensory neural hearing loss, there will be damage to the cochlea or the auditory nerve. It's very important to know that this hearing loss is permanent. You may have students that will ask you if they're still going to be deaf when they grow up. If they have a sensory neural hearing loss and you know that, then the answer is yes, and it's really important to have those conversations. If you think about schools, there aren't many staff who have hearing aids, so they may not have seen an adult wearing hearing aids, and so therefore they can convince themselves that when they grow up that they'll no longer have a hearing impairment. So it's really important to have those conversations. As I said, unfortunately, with a sensory neural hearing loss, it is permanent. You can't fix the hair cells within the cochlea. There might be damage to the hair cells. There may be liquid missing. There might be issues around the auditory nerve so that the signal is not getting to the brain in the way that it should. We then also have a conductive hearing loss, and generally a conductive hearing loss would be a temporary loss, and it can fluctuate, and often we get something called glue ear, particularly in our younger students. And what happens is in your middle ear, surrounding all your little tiny bones, you will get a sort of a fluid. So when you catch a cold and you get stuffed up, that fluid doesn't drain from that middle ear. So when sound passes through your ear canal and hits your eardrum, it doesn't go anywhere. The sound doesn't pass through. Now, as I said, this can be temporary. Many children, when they're young, get glue ear because everything's very small. So the eustachian tube that you can see disappearing down away from the middle ear can be very narrow, not allowing fluid to pass easily, and it can become very clogged. This is not to be underestimated. It can have a huge impact if not picked up, particularly for anyone who has glue ear between the ages of 0 and 3. That is when you're acquiring your language. So any impairment to the hearing at that point can impact their language development. So it's really important that if you feel that a student in your class suddenly is not hearing you in the way that they were before, please ask parents to go and have a hearing test. It's the easiest way to rule that out. And if it is glue ear, then there are lots of interventions that audiology can do to help. We also have some students who have a mixed hearing loss. So they may have a sensory neural hearing loss or a permanent hearing loss and then catch a cold, which in turn will make their hearing drop. So they might find it more difficult than they usually do to hear. And it's about making adjustments for that, ensuring that they're seated well, that they're following, that you've shared that information with other staff. We also have a unilateral hearing loss, which is a one-sided hearing loss. And assuming that the hearing in the other ear is normal, then they do fare very well. Sometimes the ear with the hearing loss may be aided with a hearing aid or similar device, or it may just be left. But as I said, they cope very well. But again, you need to consider where they're positioned within the classroom, how well they are accessing the learning. And again, those things we'll talk about in some of the other parts of this training. So along with the types of hearing loss, we also have the degrees of hearing loss. So starting with profound, a profound loss would be somebody that has no access to any useful sound. Unfortunately, with a profound loss, behind the ear type hearing aids are not powerful enough. In terms of communication, they may choose to use BSL, so British Sign Language, or they may opt for cochlear implants, which are a different type of listening device, which we will talk about further on in part 1. We then have our severe losses. Now, I would expect someone with a severe loss to have hearing aids. Generally, will be behind the ear type hearing aids. Although they will give them access to speech, they certainly will not be able to hear all of speech. And if there is significant background noise, they may struggle to hear a teacher's voice within a classroom. With a moderate loss, again, we would expect that student to be wearing hearing aids. They may have some access to speech, but they will not have access to all of speech. So without their hearing aids, they would struggle. So although it's a moderate loss, it is actually a significant loss. Even with their hearing aids on, there may still be some sounds that they are unable to access, and that may be evident in the quality of speech and the clarity of speech. With a mild loss, these are the students that we sort of tend to worry about the most, because often they won't have any sorts of amplification, so they'll have no type of listening device. The reason for this is that they will have their hearing test. Within that test situation, it's nice and quiet, they're concentrating, and they may well access all of speech within that test. However, when you then put that student back in a classroom with lots of other children and lots of background noise, that loss suddenly becomes much more significant. and they won't have the amplification to help them to hear the teacher's voice. So they are the students that we really, really have to keep a close eye on. So a degree of hearing loss will be determined by an audiologist during a hearing test. When a student goes for a hearing test, sounds will be played to them either via headphones or speakers within the room. The audiologist will plot their responses on a graph called an audiogram. And if we see here on the left, this is a copy of an audiogram for somebody with a moderate loss. On the audiogram, you can see that down the left-hand side is the decibels from soft to loud, and across the top is pitch from low to high. We also have a banana shape with lots of letters inside. This is called the speech banana, and those letters represent the speech sound, so we can see at what decibel and pitch we hear different speech sounds. So as the student is tested, they are played a series of bleeps at different pitches and different decibels, and they have to respond. When they respond, that is recorded on the audiogram. So here we can see a red line and a blue line going across the centre of our audiogram. The red line represents this person's right ear and the blue line represents their left ear. So we can see that the hearing loss isn't exactly the same in both ears, and that's quite common. What's really important is what they can and can't hear with and without their hearing aids. So this red and blue line represents what they can hear without their hearing aids on. So this test is done without their hearing aids. What's really important is the speech sounds that they can hear. So if we look here, without their hearing aids, this is what they can hear of speech. So anything underneath the lines they would have access to. Anything above the lines they would be unable to hear, and particularly if there was any sort of background noise. So for this student with a moderate loss, if they were to be without their hearing aids in a classroom, they would have no access to useful sound, and particularly no access to speech. Now, if we look further up the graph, we will see a green line. So this green line represents that same student with their hearing aids on. So now when we look underneath the line, they have a much bigger access to speech sounds. But what we will see is in this top right hand corner here, these are the high frequency sounds, and they are still very difficult for this person to hear even with their hearing aids on. And if there were to be any background noise, they certainly wouldn't be able to hear those sounds. And if we think about those sounds, they are all consonant sounds, and they are the sounds that carry the information within words. So if these sounds are missing, then there are going to be lots of bits of information missing from speech. So if you think of a word beginning with so a sound such as fish, if that student cannot access the sound, then the teacher may have said fish, dish, wish, list. There's lots of things, and there's lots of opportunities to mishear and misunderstand information. So it's vitally important that they are wearing their hearing aids every day. Even though they will still be missing some of those sounds, it's really important they have the best access to speech sounds as they can. With technology advancing all the time, audiologists are now able to sort of squash these high frequency sounds and bring them down in pitch, giving some better access to them. However, they would not be able to hear them in the same way as we would, and just generally through hearing aids you would not have the same experience as somebody listening with normal hearing. And it's really important to remember that the quality is not great. Even though hearing aids are improving all the time, they are still listening through a damaged auditory system, and so it's really important to remember that. On this slide, I would just like to play you a short clip of the Flintstones. What you will hear throughout is that it will start to drop. So it will start with how we may hear with normal hearing, then moving down to a mild hearing loss, a moderate hearing loss, and then a severe.
1, 2, 3, 4, 5, 6, 7. Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
Fred, take it easy. It's only a game.
Wilma, I'm just like them big tycoons. I play to win. Now, Barney, pay up or get out of the game.
Busted. That's 1 down and 2 to go. Betty, it's your turn.
I don't have any more money either. You got it all.
Then I'll take a mortgage on your orphan's home. Well, come on, take the dice, will you? Don't just sit there like a dummy.
I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
As you can see, there's a real significant drop between mild and moderate and how well they can hear. It's really, really important to remember that if you have a student that comes in without their hearing aids, that they are really going to be struggling to hear what's going on during the day, and that you should be contacting home to find out why they don't have their hearing aids. If it's because they've been forgotten that particular day, then I would insist that they're brought in. If it's because they are damaged, I will check whether those hearing aids have been returned to the audiology clinic, how far along in the repair process are they, and to keep coming back to that parent. What we don't want is students to get into the habit of not wearing their hearing aids, otherwise it becomes quite difficult to try and reintroduce them. So where possible, we sort of try and avoid that. So when a hearing aid is prescribed, so the audiologist will make the recommendation to fit the hearing aid. The type of device that they will use, which we will talk about in part 2, will depend on the type of hearing loss, so whether it's sensory neural or conductive loss, also on the level of hearing loss. So hearing aids can, if we have very small hearing aids, that's for a very mild loss or a moderate loss, right through to much more powerful hearing aids for a moderate or severe loss. Hearing aids can be fitted from birth. Babies hearing is tested with neonatal screening within the first 24 hours. So if a hearing loss is detected at that point, that baby would come back in a few weeks and be retested. If they feel that there is a hearing loss there, then hearing aids can be fitted, so within the first couple of months. If there is a hearing loss and it's detected early and intervention is put in place, so a hearing device is put in place and that is worn every day, then there is no reason why that child can't be age appropriate with their language. The earlier we can identify a hearing loss, the better chance they have of developing, age appropriate language. And it's really critical, and I spoke about it before, that the earlier we can do that, the better. So really, beyond 3 years, if there has been any interruptions with their hearing, that will impact their language development massively. And sometimes what happens is babies are at home, it's quiet at home, you do hear things better, and the hearing loss isn't picked up until maybe they start in an educational setting where it's much noisier and they struggle more to follow instructions or hear an adult's voice, and often the educational settings will pick that up. The problem with this is that can often be beyond the age of 3. If it's nursery, it might be between the ages of 3 and 5. We've already missed out a sort of critical window for picking up language, and most of the language that we picked up is through overhearing. So it's really, really important to follow through any feelings that you might have about a child's hearing loss. When we're looking at beyond the age of 6, so we would consider that to be a really late diagnosis. The sort of window for picking up language is reduced even more because your brain has started to make its connections, and so therefore trying to pick up a language can be extremely difficult. So it really is vitally important that the earlier hearing loss is established, the sooner that a device can be fitted, the better chance they have of being age appropriate with their language, or being able to close any language gaps that may already exist. So why are hearing aids used? So the primary function of a hearing aid is to allow access to speech. And if we think back to the audiogram, you can really see it's like a, 30 decibels or more difference between wearing your hearing aids and not wearing them in terms of being able to pick up speech. So without them, somebody would have to talk at least 30 decibels louder than they would normally for you to be able to hear them. Whereas with your hearing aids on, you'll have much better access. If a hearing aid user does not have access to speech, or somebody with a hearing loss does not have access to speech, then they will not develop speech themselves. We develop speech because we can hear speech. So if we can't hear it, it will be very difficult to produce sounds and therefore to produce speech. The type and level of hearing loss will influence which type of device the audiologist may go for. If we have a profound loss, then really, in terms of device, the only device we're looking at is a cochlear implant, or if not, BSL will be their mode of communication. But from severe downwards, there are different types of devices that we can look at, and we'll be talking about those in part 2. It's really important to understand that technology is constantly updating, so making sure that we're going back regularly for hearing tests, that if hearing aids are whistling or buzzing or making any sorts of noise, that we're getting those back to the clinic to be looked at. And although technology is advancing all the time, and it is giving people access to sounds that they may never have heard before, it does not restore normal hearing. They will always be listening through a damaged auditory system. And with times, in terms of safeguarding, we do have times when parents do not engage with the audiological equipment for a variety of reasons, and there may come a time where we have to look at the safeguarding. Is that neglect? Because if you are not engaging with the equipment that has been recommended and prescribed, then ultimately you are impairing their opportunities to learn to communicate well, and that could be seen as neglect. So it is really important that we keep a check on devices, and if students are not wearing their devices, that is followed up. So thank you for listening to part 1 of our deaf awareness training. If there are any other questions or you'd like any further information, then please feel free to email me. Or if you've got more general inquiries about Send Success Outreach Team, then there's an address there for inquiries at sendsuccess.org, or alternatively, you can call us directly on our office number, which is on the screen there. So thank you very much for listening, and hopefully you will join us for part 2. Thank you.